Hi, I'm Dr. Lavi Sidhu. Today I'm going to discuss about uterine fibroid, its causes, symptoms and treatment. What are uterine fibroids? These are also known as myomas or leiomyomas. Fibroids are tumor-like growths in the uterus. They are non-cancerous and very rarely develop into cancer. Fibroids are very common in women during the childbearing years, and it may grow along the wall of the uterus as well as into the cavity. So depending on their growth, they are classified broadly into three categories: subserosal, intramural and submucosal. They can range in size from as small as seedling to a bulky masses that can deform and enlarge the uterus. There can be a single fibroid or multiple ones. In very rare cases, there can be multiple fibroids, which expands the uterus so much that it might reach the ribcage. So, what are the symptoms of uterine fibroids? These can be asymptomatic or symptomatic. Many women might have uterine fibroids sometimes during their lives, but they don't know they have uterine fibroids as they cause no symptoms. A doctor might discover uterine fibroids incidentally during a pelvic examination or a prenatal ultrasound. But in women who are symptomatic, the most common symptoms will be: number 1, very heavy bleeding during menstrual cycle. Second, longer than usual menstrual period, that is more than 7 days. Third, there might be a bloated feeling in the lower abdominal area. Fourth, there would be a feeling of pressure or even pain in the pelvic region. Fifth, there might be increased urge to urinate frequently. Sixth, a woman having fibroids may be constipated. Seventh, there may be difficulty in conceiving, that is infertility. So here I would like to say that having any of these symptoms doesn't necessarily mean that you may have fibroids. These are general symptoms and could be due to other reasons as well. So it is recommended that if you have any of these symptoms, consult a doctor and he may do necessary tests to confirm the diagnosis. Now, what are the causes of uterine fibroids? The actual cause of fibroid is unknown, but some of the reasons may be due to hormonal factor. There are two hormones in our body, estrogen and progesterone, that stimulate the development of the uterine lining during each menstrual cycle, and these hormones can promote the growth of fibroid. Second factor could be genetic changes. Some research says that fibroids could be hereditary, as many fibroids contain changes in genes that differ from those in a normal uterine muscle cells. However, there is no conclusive evidence on this. Another factor could be growth factors. These are some substances which are secreted into our body which help to maintain the tissues, such as insulin-like growth factors. These growth factors might affect the growth of fibroids. Now the important question: what is the connection between pregnancy and fibroids? Fibroids usually don't interfere with getting pregnant. However, it is possible that fibroids, especially the submucosal fibroids, can be a reason for infertility or pregnancy loss, and some large intramural fibroid, that is more than 4 cm, can affect the fertility. Fibroids may also raise the risk of certain pregnancy complications such as placental abruption, fetal growth restriction and preterm delivery. Now, what are the treatment options for uterine fibroids? Treatment is recommended only if it is causing any symptoms. Generally, uterine fibroids reduce or disappear as women enters the menopause. If you have symptoms, then it is best to talk to your doctor and he will suggest the best treatment plan according to your size and position of the fibroid. Some doctors recommend this wait and watch technique to ascertain if treatment is required or not. Some suggest medications to regulate your menstrual cycle or treating symptoms such as heavy menstrual bleeding and pelvic pressure. Medications will help to shrink the size of the fibroids. There are various medications available. Among one of them is the gonadotropin releasing hormone or GnRH agonist. They treat the fibroids by blocking the production of estrogen and progesterone, putting you into a temporary postmenopausal state. As a result, the menstruation stops, fibroid shrinks, and anemia often improves in patients. Another important medical treatment is a progesterone-releasing intrauterine device, which can relieve the heavy bleeding caused by fibroids. There are also other medications available which decrease the size of fibroid as well as the bleeding loss. A doctor may recommend myomectomy, a procedure to remove the fibroids. This procedure can be done either hysteroscopically, laparoscopically, or through the open surgery depending on the size of the fibroid and the location of the fibroid. Another treatment option, that is hysterectomy, that is removal of the uterus and a permanent solution to prevent the fibroids, which is usually indicated if the family of the patient is completed. There is also a non-invasive procedures performed using an ultrasound transducer to destroy the fibroids, which is a latest technology. It is also known as MRG-FUS, magnetic resonance guiding focused ultrasonographic, which destroys the fibroid tissue using the ultrasound rays. Another minimally invasive procedure is uterine artery embolization to destroy the fibroids. So these are the different treatment options available depending on the number of fibroids, size of fibroids, symptom of the patient, and the age group of the patient. So now, how can Medicover Fertility help a woman with uterine fibroids? Medicover fertility clinics are among the top fertility clinics in Europe and now available in India. With state-of-the-art technology and technical expertise of doctors, we have been helping patients dealing with fertility issues. You can contact Medicover Fertility, where you will get the best advice from experienced infertility specialists who will suggest the best possible treatment for uterine fibroids. If you are unable to get pregnant after several attempts, you should consult us and find a solution to your problem. Thank you for watching this video. If you have any questions or concerns regarding uterine fibroids, then you can drop your questions in the comment section below or call us on 786-2800-700. Thank you.